This is One-on-One. Dr. Jeffrey Boscamp, Chairman and Physician-in-Chief, the Joseph M. Sanzari Children's Hospital at Hackensack University Medical Center. Good to see you, Doc.
Good to see you. Thanks for having me on.
We've had many conversations off the air. Let's have it right now. You say that the Children's Hospital there is a pain-free hospital. We were just talking about it. Make that clear. What does that mean?
Well, basically, kids should never have to experience pain. In the past, it was a part of getting medical treatment. I mean, you just took a kid and you did what you had to do. If there was some screaming involved, that was okay. It was the price you had to pay. Now, that's unacceptable. We do not allow children to experience pain. If we need to have them go to sleep, if we need to give them special numbing medications, pain control, whatever it takes, they should never experience pain in the environment.
You know, some people say, hey, there's a hospital that has a pediatric unit. I've seen that wing. But you have something different. What's the difference?
The difference in a children's hospital is that it's a hospital that takes care of children and their entire families. So we're not just putting kids in the hospital, taking care of whatever their medical condition is and sending them off. It's a much, much bigger picture. We've got a ton of specialists that we can mobilize at the bedside in 15 minutes. We're not calling people in from other places, and then the whole other picture. So we've got child life people who are trying to ease their trauma. We've got social workers working with the family. We treat the entire family, not just the kid.
You know, because our kids have been in hospitals before, and I see the experience, I don't experience, but I see their anxiety, and I know our anxiety. Talk about the the anxiety for children and their parents.
Yeah, I mean, our whole approach is that we should make that anxiety not exist. It's hard, but simple little things that you can do to give kids safe zones in the hospital, so that when they go to a playroom, doctors don't walk in with their white coats and scare them. In our playroom, we've got a little mini CAT scanner. So it's made out of wood and the kids can sit in it. And then when they go to see the real CAT scanner, they're not afraid.
It makes a difference?
It makes a difference. And our child life people work with them. They take them to the OR before they ever get to the operating room, so that they've seen it in a calm environment, so that when they get there, they're not anxious. Same thing for the parents. Parents participate in the rounds and everything with the doctors, so that they're not hearing language that they don't understand and makes them anxious. They're part of the whole healthcare team.
One of the areas I know that has been very important to you from a clinical point of view, and you've grown this initiative, infectious disease. Talk about it.
Well, look at the world around us every day. I mean, what are we hearing about now? We're hearing about measles outbreaks. We're hearing about a huge West Nile outbreak in the United States right now, centered in the Dallas area, but moving all over the country. We're seeing spraying in New York City and different areas. Infectious disease is constantly involved. I've been privileged in my life to be dealing in this area that's constantly evolving, new challenges that we have to meet.
Name some. Name of the biggest issues we need to be worried about in terms of infectious disease. Some of those diseases are?
Well, I think right now, you know, diseases that we thought were completely gone, that we had the ability to get rid of. So measles is a perfect example that we're seeing measles. We're seeing a huge outbreak of whooping cough, of pertussis right now. So there's a disease that was gone, right? But now, because of the fact that a lot of people have said, why do I need to immunize my kid against that? It's gone, right? I don't need to deal with that. We're seeing big pockets of kids that aren't immunized, and just what we thought might happen. You know, there's reservoirs of whooping cough out there. There are diseases that are being imported from other countries, and we have a susceptible group of patients and kids because they've never been immunized. So, you know, that's the big deal.
Sorry for interrupting, Doctor.
Sure.
So what are you doing? Are you dealing with prevention? Are you dealing with, hey, we've got a situation, we've got to play catch up? What are you doing?
It's really all the above. I mean, we got to get the word out there that these diseases are still there just because we haven't seen them. Things like polio still exist in the world. Things like measles are out there. Now, we don't see them because we've done such a great job in protecting our kids. But once you start to let down your guard a little bit, these things come back, and we're having that experience right now. Just like, you know, you being incredulous, whooping cough, who sees that?
Right.
We have kids that are in our ICU on a ventilator, babies, because of whooping cough these days. And I'll tell you, those parents, if they made a decision not to immunize their kid, they're really having second thoughts about it right now.
By the way, put the name of the hospital into perspective. Joe Sanzari.
Joe Sanzari is an incredibly generous, amazing guy who realized what the needs were, realized what we could do for kids and families, and has been an incredible supporter of Hackensack University Medical Center, and particularly the Children's Hospital. I mean, I'm really proud to be the chief of a hospital with his name on it. Anything we need, Joe Sanzari really helps us.
There's another piece here. The Healthy Futures piece is curious to me. Is it just about weight loss?
Well, it's about weight loss, but weight loss is not so simple as you think, right? So what's weight loss? Eat less, do more exercise. Very simple, right? It's so much more than that. So what this program is about...
What's it called again?
Healthy Futures.
Healthy Futures.
So that's what we want to build for these kids.
By the way, you're on the website there, folks. Go there and you can find the Healthy Futures Initiative. Go ahead, Doctor.
So basically, we looked at this and said, you know what, it's not good enough for us to sit in the hospital and wait for kids to come in, make them better when they come to see us. We need to advocate for kids. We need to be out in the community. So weight loss is more than just exercise. We help them with an exercise program. We teach them about how they could eat less, but we also teach them, we have dietitians teach them eat better, all right? We also have psychologists to ask the question, why are you eating so much? And guess what happened? The most amazing thing happened in Healthy Futures. We had these kids come in. We thought we could make them lose weight. They did. So in the program, they're losing weight. The whole family lost weight. This was a huge success.
Well, how does the whole family get involved if you're dealing with
Because
the
all
kid?
of a sudden, we're dealing with this kid who we're emphasizing exercise, we're emphasizing a healthier lifestyle. We found out the whole family started eating more healthy. It wasn't just our kid in the program. The food they were putting on the table was much better. The whole family got into the mindset. We couldn't have been more excited about the fact that the whole family started losing weight, because that's a game changer.
I'm curious about this. You have been in medicine for how long?
I've been at Hackensack University Medical Center for 25 years and been a doctor for about 35 years.
I'm listening to you and watching you right now, and you're leaning forward in your seat. Every time I talk to you, you have the same intensity and passion. When did you know that medicine would be your professional life, and that this particular aspect of medicine, dealing with children, would be your professional life?
Well, it's interesting. You get to medical school and you're not sure what you're going to do. You have this really, very, very nice and very idyllic view that you're going to help people, but you don't know exactly how. And then as you get to be a third-year medical student, you go into surgery and you start helping deliver babies, and you're taking care of adults and kids. And it's very interesting how the medical school class sorts out. All of a sudden, there's this group that says, this is where I see myself. You have a group of mentors who are in front of you, and you say, I want to be like that person. And I have to tell you, dealing with the kids, dealing with the pediatricians, for me, I think the kids kept you honest. You could never have too big an ego. The kids would just tell you, just stop it. And I loved that whole environment. I love being able to influence somebody's whole life early in life, to save a kid at a young life, to see what that's going to do for their entire long life. I think that's extraordinary. And to follow kids as they grow and develop across those first 21 years, it's an extraordinary experience.
And finally, dealing with and having an impact on their parents has to have a big impact on you as well.
Well, that's a big part of pediatrics. You're not just dealing with the kids, it's that whole family and dealing with the parents, and you have to like doing that. I love sitting there, not just talking to a kid, but also talking to that entire family and having them understand exactly how we're trying to work together to get that kid better.
Dr. Jeffrey Boscamp is the chairman and physician-in-chief at the Joseph M. Sanzari Children's Hospital at Hackensack University Medical Center. Doctor, as I said, every time I talk to you, I appreciate your intensity, your passion, and your commitment. Thank you very much.
Thanks for having me here.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child, and by Wells Fargo. Promotional support provided by NJ Biz, All Business, All New Jersey, and by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.